Good morning, everyone. My topic for today's presentation is transient smartphone blindness. So, transient smartphone blindness it's a recent phenomenon characterized by acute painless transient vision loss associated with smartphone usage while lying down in the dark. The increase in screen time and lack of change in focal length leads to many ocular problems, and transient smartphone blindness is just one among them. So, approval was obtained from DEC and study was conducted in accordance with the tenets of the Declaration of Helsinki. In this study, which was conducted among our college students, each of the 454 residents of the college hostel have experienced a sudden episode of transient blindness after prolonged screen time, especially during night, at least once. So most incidences occurred while going to the washroom and resolve after reflex closure of eyes for a few moments. All students have reported this to be uniocular. So what is the physiology during adaptation? There's alteration in pupil size, there's switchover between rods and cones, there's bleaching or regeneration of the photopigment layer, and there is feedback from horizontal cells to control the responsiveness of photoreceptors. So this is just a depiction of a student looking at his smartphone with one eye closed. So symptoms occur specifically at night while in recumbent position immediately after turning off a smartphone screen at which they had been looking. The affected eye was contralateral to the side to which the patient was lying and resolved within minutes without leaving any residual blindness. So it occurs due to the temporary discrepancy in bleaching of the photopigment and ultimate light adaptation between the fellow retina. Probably the reason why sailors would keep one eye patched for off-deck visualization when they go inside the deck, and other eye would be light adapted for on-deck visualization. So the differential diagnosis, it must be distinguished from other causes of acute transient vision loss, especially thromboembolic diseases such as amaurosis fugax. Age is an important differential factor. It is seen generally in young. While non-arthritic anterior ischemic optic neuropathy may cause acute painless unilateral vision loss, but symptoms would be expected to persist. Additionally, in multiple sclerosis, patients would have some kind of color desaturation and abnormal MRI findings. So it has been suggested that patients should use only smartphones in well-lit rooms, and to assure that neither eye is occluded, should be conversely advised against smartphone usage in dark sittings in order to prevent the recurrence. And incidentally, this would also be expected to improve the patient's sleep hygiene. Uh, Correct diagnosis of TSB is imperative, as incorrect diagnosis may put the patients at risk. If misdiagnosed as thromboembolic etiology, patients may be unnecessarily started on anticoagulation, which can pose obvious bleeding risk to the patient. If incorrectly treated as multiple sclerosis, the patient may be inappropriately started on disease-modifying therapies, which pose significant side effects as well as financial burden. In addition to the field of ophthalmology, recognition of this entity may also be relevant to other physicians, such as the physicians of the family medicine, internal and emergency medicine. Ultimately, this phenomenon emphasizes the importance of thorough history taking in ophthalmology and in the field of medicine. So take home messages: the incidence of transient smartphone blindness will surely but definitely increase in coming times. There is a need to create awareness among middle-aged and middle-aged population, especially the youth, to understand what it is and how it occurs, and there is need to stay calm. Screen watching should preferably be done in a well-lit room, and an awareness should be created among general population about working in a well-lit space and potential morbidities it can avoid. These are my references. That would be all. Thank you.